for everybody to connect to audio. And then we'll begin. Okay, looks like most of us are good. Hi, everybody. Thank you so much for joining us this evening for the OCIC Youth Policymakers Hub Policy Matters series. My name is Rachel. I'm a current Youth Policymakers Hub member. I'm also the project manager for an international humanitarian development charity called Good Neighbours Canada. And I'm a feminist activist who, like many of us here today, is very eager to learn more about Canada's commitments to advancing gender equity and its international support. To give you a brief overview to us, the OCIC Youth Policymakers Hub, or YPH for short, is a diverse group of 25 youth from Ontario, and we are all aged between 20 and 25 years old, seeking to engage in international cooperation policy processes in support of gender equality. We also focus on Canada's Feminist International Assistance Policy action areas and the UN Sustainable Development Goals. You can find more about us on OCIC's website, and I believe the link is going to be shared in the chat for everyone. So this year, we're focusing our flagship programme for the YPH, the Policy Matters series, on the Feminist International Assistance Policy, with a monthly focus on each of its action areas. For today's session, we're going to be focusing on the topic of human dignity. We're thrilled to have Maya Israeloff-Smith, the Gender Equality and Inclusion Specialist from CARE Canada, with us here today. Before we begin, I'm just going to share a bit of housekeeping today. So firstly, you'll have all seen when you came in, today's session is being recorded for note-taking and is going to be disseminated on OCIC's social media platforms for reporting purposes. Secondly, if you'd like to keep in touch with us, you can follow us on social media. OCIC is on X, Instagram, LinkedIn, and Facebook, all of which are also being shared in the chat by the lovely Pragya right now. And lastly, at OCIC, we are committed to creating a safe and inclusive space. We ask all of you to please commit to our Code of Conduct, which has been inspired by those of the Inter-Council Network, ICN, and Amnesty Canada. Our Code of Conduct, which is also going to be shared in the chat, outlines our shared commitments towards respect, inclusion, humility, safety, solidarity, patience, and openness for all of our participants and all of our collaborators. If at any point this evening you see or experience anything which is in conflict with this Code of Conduct, please do not engage with the perpetrator directly. You can contact one of the organisers of this event and we will respond appropriately. And with that, I will now pass it to Branavi, who's going to give us a land acknowledgement.
Hi, everyone. We at OCIC recognize and honor the Indigenous peoples who have historically and do presently live and work on the traditional both treaty and unceded territories that we operate on. These include the Huron-Wendat and Inuit First Nations, the Seneca, the Haudenosaunee, the Anishinaabe, the Mississaugas of the Credit River First Nation, and many others. We acknowledge that our staff, board, volunteers, members, and broader community operate on the treaty and unceded territories and numerous other Indigenous peoples and nations. As we reflect on our role within a settler colonial context, we acknowledge the importance of naming the Indigenous peoples and nations on those lands we work, live, and play, and understand the importance of framing our engagement in the international corporation sector and beyond through the eyes of reconciliation. We recognize that we have a responsibility to stand in solidarity with Indigenous peoples who have and continue to fight for social justice on our own lands. With this, we now move on to our next segment, and I would like to pass the floor to Bernice.
Hi, everybody. My name is Bernice, and I'm going to be leading today's engagement activity just ahead of the session. Just allow me a moment to share my screen. Perfect. Okay, so the action area that we are going to be focusing on today is human dignity, which is FIAP Action Area 2. This is actually quite a broad area and actually encompasses 3 core focus areas, one being health and nutrition, the second being education, and the third being gender responsive humanitarian action. So we'll be going through each of these sections a little bit briefly and go over a couple of activities just to make sure you're all caught up and understand what Canada's priorities in these areas are. So yeah, it should be fun, it should be engaging, but let me walk you all through it. So the first core area, again, is around health and nutrition. So Canada just officially recognizes that health is a really important area for development. It's just identified across numerous areas as something that is going to be able to improve the livelihoods of people when it's invested in. It's something that continuous investment is able to just create multiple effects across various areas. And the position that Canada is taking on this is that there are very critical gaps that exist in healthcare systems around the world. Women and girls, especially in marginalized situations, bear our disproportionate burden of disease and mortality. And so what Canada's priorities, particularly in health and nutrition, are improving health services broadly, supporting comprehensive and multi-sectoral approaches to sexual reproductive health and rights, otherwise known as SRHR, and then enhancing access to nutritious food for women, adolescents, and young children. So within this health and nutrition bracket, there is actually a lot of focus that is placed on maternal health care. So that's healthcare that is focused towards women who are experiencing pregnancies or just about to experience a pregnancy. And so for this first activity, I actually do have a couple of true or fact statements that I'd like to run through with all of you. So to participate in this, please feel free to leave a comment in the chat box on whether you think a particular statement is true or false, and then I will drag it to the correct section. So for the first particular statement, proper nutrition is critical for the first 1,000 days of a newborn's life. Do you folks think that this is true, or do you think it's false?
A lot of people are saying true. I'm just saying it out loud because
Nice. Thank you.
yeah.
Thanks so much. I have an issue with
myself. Yeah.
Mostly true. That's perfect. Yes, that is correct. So it's been identified that proper nutrition is absolutely critical for the first 1,000 days of a newborn's life. Yeah, that is true. For the second statement, we have that of the nearly 127 million women who give birth every year in developing regions, about 28% of them do not deliver their babies in a healthcare facility. Is this true or false?
We have one false and a couple of trues.
Perfect. Okay. This is, yeah, a little
false. I think Kendra says to be a higher number.
That's good to know. Yeah, so for this one, it is a little bit tricky, but it's actually true. And that's a very important point to note that there's just a lack of adequate healthcare facilities in certain developing regions around the world, which is leading to a lot of complications sometimes with pregnancies. Okay, and then for the third one, an estimated 1 million stillbirths occur per year. Is this true or false?
We have a couple of mixed, I think mostly true, but Rachel thinks it could be a higher number.
Yes, that is absolutely correct. So this one is false. It is actually a higher number. The actual figure itself, I think, is 2.6 million stillbirths occur per year, which is pretty high. So yeah, this one is false. Perfect. And then for the final one, the number of maternal deaths in the past 25 years has actually fallen by 25% worldwide. Is this true or false?
We're getting a couple of false in the chat.
Interesting, yeah. This one tripped me up as well, but this is actually true. It's very interesting to know that it seems that there actually is a higher uptick, and it looks like women's conditions are actually improving. And actually this point will take me on to the next section. There are a couple of interventions that a lot of social policy researchers think could really support with ensuring that women do not die during childbirth, and that maternal deaths are just not as common. And a lot of these particular solutions and recommendations have actually been put together by a report by an organization called Women Deliver. And so I've pulled them all up for us to see here. But first, I did want to acknowledge a big portion of what they were talking about in that particular report, in that solutions and interventions to address the disproportionate burden of women in childbirth exist on a continuum. So that ensures that there is a high quality of care, not only during pregnancy and labor, but also during pregnancy and during the postpartum period. So there are a couple of solutions that they're suggesting, which actually all work together to make sure that women do not experience these types of complications. So I will share the link to the Jamboard with all of you in the chat so that you can hop in here and drag all of the solutions that we have identified below into this solutions box over here on the left. Let's see if folks are hopping in. So yeah, if you could just drag the solutions over into the solutions box, and then we can move on into the next activity.
Sorry, Benny, what's the question? The ones that we think have been
No,
put
all
into
of them are
policy already?
solutions. All of them
Oh,
are
I see.
solutions, yeah. So yeah, this one, I didn't want to make it too complicated. So yeah, it's just moving them along, and I guess learning something new today. Perfect, thank you. All right. So again, yeah, these are some of the solutions that have been suggested. I found them to be really interesting. I can drop the report and share it with you all after this meeting, so you can access it as well and just understand the breadth of the research that they undertook. But for the sake of time, I will move on into the next section. So yeah. The second focus area in FIAP 2 is education. And like we've all experienced, I'm sure, education is a very powerful tool for empowerment, and it's a catalyst for improving human dignity. But still, there are 130 million girls worldwide between the ages of 6 and 17 who are out of school and will likely never step into a classroom. There are a number of complex and interlocking factors that could prevent a young girl or a young child from going to school. Some of these factors could include things like, distance, overcrowded or unsafe schools. There's certain regions of the world where the distance between a person's house and the nearest school is really, really far away. It could be upwards of 50 to 100 kilometers, which makes it such a challenge to be able to trek there and come back. There are, in some cultures, in some regions, very specific familial attitudes about girls attending school. Sometimes it's overarching cultural attitudes about sometimes children with disabilities attending school. All of these are factors that definitely play a part. A third factor definitely can also include a lack of funding for the child to actually go to school in places where public school is not funded, or even in situations where school is funded. There sometimes are just issues of serious underfunding, which can prevent somebody from accessing school in the first place. So yeah, these are a couple of factors. What I wanted us to do in this next activity, which might be a little bit challenging, is actually a word search. The factors that I specifically mentioned, safety, underfunding, family pressure, overcrowding, fees, access, prevailing attitudes, are all nestled in this word search somewhere. So I'll ask you over the next couple of minutes to try and identify the words and just circle them. You should be able to do that if you have access to the pen tool or marker tool that's on the cursor on Jamboard. And then yeah, once we're done, we'll move on to the next section. It's amazing. You guys already caught some already. Perfect. You guys caught all of them. That was amazing. So yeah, again, these are some of the interlocking factors that could prevent a child from accessing education. And then for the final section, we're just going to do a final true or false activity. Humanitarian action being the third and final focus area in this particular action area. And humanitarian action being identified in Canada as assistance that is intended to meet the needs of people who are affected by armed conflicts, as well as from natural disasters as a result of climate change. So just like the previous activity that we did, we're just going to go through a couple of statements. You guys will let me know if you think they're true or false. The first statement being that Afghanistan has received the highest portion of federal international assistance for humanitarian action.
We have it true.
Perfect. That is correct. This is true.
False.
Interesting. Okay. Yes, this is actually true. So at least in monetary terms, Afghanistan has definitely received the highest portion of federal international assistance for humanitarian action. And then the second statement being that humanitarian action encompasses SDG 1, which is no poverty, SDG 2, which is zero hunger, and SDG 5, which is gender equality.
I have a question. Is that like just those, is the question to mean encompasses just those three or not limited to those three?
I'd say maybe not limited to those three. There's actually more. I just couldn't include them in all of this.
Yeah.
Okay, you got that. That's pretty good. Perfect.
Yeah,
Okay.
we have two falses and one true.
Yeah, it actually encapsulates one more. But yeah, I'd say not limited to. So I'll put it in true. And then the final one being that the highest allocation of international assistance funding in monetary terms has been to this particular area, humanitarian action. This is true or false.
We have some true in the chat.
So this one actually was false. Based on the 2020-2021 report that was presented to Parliament around FIAP, it looks like actually health and nutrition was the area that was allocated the most amount of funding in terms of monetary terms. But humanitarian action was pretty high up there too. Perfect. All right, so that is actually everything from me. Thank you so much for participating. Yeah, thanks so much, everybody. Thanks, everybody. I'll now pass it to Sagrika for the introduction.
Hi, everyone. Bernice, that was great. I learned a lot. Without further ado, I'm pleased to introduce our speaker today for the Policy Matters session. I'd like to welcome Maya Israeloff-Smith. Just a little bit about Maya. She works at CARE Canada as a gender equality and inclusion specialist, where she provides technical support to nutrition and sexual and reproductive health projects in both French and English. Before joining CARE, Maya worked as a technical advisor supporting nutrition and health programming and lived across various countries, including East, West, and Central Africa. Maya is passionate about advocating for rights of women and girls to adequate health, nutrition, and economic opportunities. In her spare time, she loves to travel, hike, discover new foods, and learn new languages. It's really good to have you on this session, Maya. And Devin, over to you.
Hello, everyone, and welcome to today's Policy Matters session hosted by OCIC's Youth Policymakers Hub. I am Devin Jerofi, your moderator, and today we're diving into a crucial aspect of Canada's Feminist International Assistance Policy, human dignity. We have the privilege of having Maya with us today, and without further ado, let's jump right into our discussion. Maya, thank you for being here. Could you discuss the need to focus on Action Area 2, specifically human dignity, and why it's so important to stress on it?
Thank you. Thanks so much for having me as well. Thanks for the introduction. So I think for this first question, I think Bernice already started to explain a little bit about why this action area is so important. So when we talk about human dignity, it's really about focusing on ensuring that the most vulnerable populations in the world have adequate access to essential services. And in the case of this action area, this includes health, nutrition, education, and humanitarian response, specifically response that is gender responsive. And as we have seen, the world continues to face global economic, climate, public health crises, and this creates fragility in these systems around the world, which is why it's even more important to make sure that these essential services are not being threatened. So I'll start by talking about health first. I'll talk about health and nutrition separately because they are related, but also quite different. So health, it's really about the ability to access services that ensure someone's physical and mental well-being, but it's also a strong determinant that influences other pillars. It influences economic growth. It determines outcomes like education. And it's very interlinked with gender. Traditional beliefs about gender challenge the ability of women and girls around the world from accessing health and nutrition services. So when we consider sexual and reproductive health more specifically, women and girls face barriers to making decisions about their own bodies. They don't always have the ability to access the resources required to claim their rights to health, even if those services exist. And sometimes those services don't exist in the way that women and girls need them, or they're not specifically meeting everyone's needs. And when it comes to nutrition, it's well known that nutrition and gender equality are very closely linked. Gender inequality can be a cause of malnutrition and also a consequence of malnutrition. About 60% of the world's people that face chronic hunger are women and girls. And there's very strong norms that exist impacting women and girls' nutrition outcomes. One example that's actually used in the FIAP itself is the norm that women and girls eat last in the household. Another important thing to note about the nutrition and health aspect of this action area is that the healthcare workforce is disproportionately made up of women. They make up 70% of the healthcare workforce. However, despite this, they're often not included in decision-making forums that influence health policies, even though they're disproportionately affected by those policies. So that's kind of where the specific focus comes in for nutrition and health. Moving on to education. Education, as we know, is a really important tool for empowerment. It equips people with knowledge, skills, and confidence to secure dignified futures. And it's also a mechanism that is used to exercise rights, to transform harmful social norms, especially from an early age, and to address behaviors that perpetuate unequal power dynamics, which includes gender inequalities as well. It's also well known that health and education outcomes are deeply connected, and this is also why they're two areas of focus within the same pillar, because they are so intertwined. So it's really important that this action area specifically addresses the fact that a lack of education can impact health-related outcomes. When we look at things like early and forced child marriage, pregnancy, early motherhood, sexual and gender-based violence, infrastructure relates to wash and sanitation, impacting, for example, menstrual hygiene. All of these barriers can contribute to a reduced ability to access education. And the final piece of this human dignity action area is gender responsive humanitarian action. So I think it's important to also understand what we mean when we say gender responsive. So gender responsive really means that we're going beyond just looking at working within existing systems, and we're actually implementing programs or actions that challenge existing gender norms and structures. And so the FIAP recognizes that women and girls are disproportionately impacted by humanitarian crises in unique ways. But they're often left out of decision-making regarding what happens during an emergency. So the policy really wants to empower women and girls to have decision-making roles when it comes to humanitarian response and emergency response, and protecting them from the specific challenges that it might be faced with, like gender-based violence, as an example, and for them to really have a stronger role in conflict resolution. It's also very much aligned with CARE's approaches. So when we look at the way that women and girls are impacted during emergencies, oftentimes they become much more vulnerable. Their health and safety can be at greater risk. They're often the first to lose their means of income when economic crises occur. And as I mentioned before, they're often eating last when food becomes more and more scarce. So I think for me, that's in a nutshell why I think this action area is so critical and so important, especially when looking along the different specific pillars that fall within the action area too, the human dignity action area.
Well, thank you for sharing about the different pillars that revolve around action area 2, and for stressing its importance. Could you introduce us to how it's connected to sustainable development goals and other government commitments?
Yeah, sure. So I think I mentioned this a little bit, but of course, the FIAP is intertwined with the 2030 Agenda for Sustainable Development. It's very much interlinked with many of the different SDGs. So I won't go through all of them, but I did want to highlight some of the key ones. So it's clear that in a feminist policy like this, at the core of this policy and the core action area is surrounding gender equality. So SDG 5, which aims to achieve gender equality and empower women and girls, is at the heart of the FIAP and Canada's approach, and it is at the heart of the core action area. But this pillar is also in alignment with various other SDGs. So the first one being SDG 3, which focuses on good health and well-being. So I tried to take a look at each SDG that I felt was in alignment and just highlight specific targets that I felt were most aligned to the human dignity action area. So under SDG 3, which is the health SDG, target 3.7 aims that by 2030, there is an assurance of universal access to sexual and reproductive health care services, including for family planning, information and education, and the integration of reproductive health into national strategies and programs. So this SDG has a very specific target area linked to sexual and reproductive health, which is also a very strong focus in terms of the investment that the government of Canada has made in the health action area. So for the second SDG I wanted to mention is the hunger SDG. So SDG 2, zero hunger. It's more specifically the aspects of this goal that are nutrition specific. So target 2.2 under SDG 2 aims that by 2030, all forms of malnutrition are ended, including achieving by 2025 the internationally agreed targets on stunting, wasting in children under 5, and addresses the nutritional needs of adolescent girls, pregnant and lactating women, and older persons. So this target within the nutrition SDG 2 is much more focused on reducing malnutrition within the context of a health system and also with a target of vulnerable populations. The I guess fourth technically SDG that I wanted to mention is SDG 4, which is for quality education. And under this SGD, there is a specific target that relates to eliminating gender disparities. So target 4.5 aims that by 2030, gender disparities in education are eliminated and ensures equal access to all levels of education and vocational training for the vulnerable populations, including persons with disabilities, Indigenous people, and children in vulnerable situations. So there are other SDGs that are in alignment with the Human Dignity Action Area, but those are 3 that I felt were particularly relevant to what's being focused on under this action area, specifically when talking about health, nutrition, and education.
And thank you for speaking about the intersectionality between FIAP's second area of human dignity and the Sustainable Development Goals. I'd like to slightly shift our focus to your role at Care Canada. And how is Care Canada advancing this action area?
Sure. Yeah. So Care Canada has several different partnerships with Global Affairs Canada, and the projects that we work on, which are funded by the Canadian government, are in alignment with the FIAP. So I wanted to give 2 examples. As you heard in the introduction, my focus is on gender equality, specifically within the context of nutrition and health projects. So I'm going to give 1 health project example and 1 nutrition project example. So the first project is called FAMCAD, and it stands for Women and Girls Standing Up for Dignity for Our Sexual and Reproductive Rights. The word comes from Creole. It's a project that's being implemented in Haiti. It's a 4-year project. And the aim of this project is to improve access to health resources and services, particularly sexual and reproductive health and rights, to women and adolescent girls. And the project targets over 70,000 Haitian women, men, adolescent girls, and boys. So the project targets mainly women and girls, but also has a strong involvement of men and boys in its approaches. So the context within Haiti, the country has experienced recurring humanitarian crises that has perpetually impacted social delivery systems. And so this project really wanted to create a strong focus on women and girls and aim to ensure that they're free from all forms of violence and able to reach their full potential and exercise their rights. And so this project really aligns with the Government of Canada's priorities, specifically to reduce gender gaps and increase access to sexual and reproductive health services, which includes services that support survivors of gender-based violence. So this project is interesting because it has a health system focus, a community or social norms focus, and policy and legal focus. So CARE is the lead implementing partner, but we also partner with 2 other international organizations. One is called Santé Monde in French, or Health World. So they're a health organization. The other one is Avocats Sans Frontières, which is Lawyers Without Borders. So they're focused more on the legal framework side of things. And then CARE is more so focused on community engagement and shifting social norms. We also have 3 partnerships with local organizations that work on health, sexual and reproductive health rights specifically, that also work on legal rights, specifically within the context of supporting survivors of gender-based violence. And we also have an organization that works at the social service delivery level. And so the project works closely with local communities. It aims to improve the ways that Haitian women and girls access rights to sexual and reproductive health care and services. And as I mentioned, the project also engages strongly with power holders, including community leaders, opinion makers, and men and boys in the community, to drive gender equal rights and access to sexual and reproductive health services and education as well. So that's one project that we currently have in implementation that focuses on sexual and reproductive health. The second project I wanted to talk about is a nutrition project. So CARE Canada has worked on several nutrition projects in the past. Many of our nutrition projects aim to improve the nutrition status of women and girls and children. So the second project is called Feed 2. It's another project that's funded by the Government of Canada, and the lead implementing partner is World Vision, and CARE is partnered with World Vision in implementing this project, but we are the gender equality lead on the project. So we're responsible for the gender equality outcomes on the project. And the goal of the project is to reduce inequalities in how women and men access and control food resources. So by doing an enhancement of women and girls' skill and leadership in how they manage threats to food production, such as drought, flooding, and conflict, providing women with agricultural and business training that will help them generate more income, and reducing the prevalence of sexual and gender-based violence, which prevents women from participating safely in agricultural activities and becoming leaders in their communities. So this project is being implemented currently in South Sudan, and it's a continuation of Feed 1, which was the initial project. And based on the lessons learned from the first phase, this second phase, with consideration as well for the FIAP priorities, really took more of a gender transformative approach and added specific targets that address the burden of gender-based violence, as this was identified as a really strong factor in the community that would determine the success of different interventions, especially ones related to nutrition. So that's, in a nutshell, two project examples that I feel are related to the human dignity action area. Open to answering any questions about those, or I'm not sure if you want to wait till the end for questions.
Actually, we'll have a brief section where we'll open questions to the audience. But it's really interesting to hear about the importance of cross collaboration between partners to address these challenges. And also, thank you for sharing how CARE Canada is advancing this action area. I'd like to delve into the dynamics of collaboration and challenges. Maya, as a civil society partner working in this area, we're keen to understand the intricacies. So could you shed some light on the opportunities and challenges you've encountered when working with other CSOs and the private sector, and for that matter, the government, in advancing action area 2, human dignity?
Yeah, so I thought for this question, I wanted to spotlight a very specific approach that CARE Canada has been implementing. And this approach really aims at, it's essentially a localized approach that really aims at advancing the capabilities of women's organizations that are locally based. So the approach is called Women's Voice in Leadership. And just a little bit of background on this approach, it's actually part of the FIAP. It was created by the Government of Canada when developing the FIAP to meet the needs of local women's organizations in developing countries. And the support aims to help advance gender equality and empower women in developing countries with a specific focus on women-led organizations. So this was announced in June of 2017, and it's embedded within the FIAP. And so because of this, CARE has an ongoing Women's Voice and Leadership project, what's the name of the project, which is being implemented in 4 different countries. So Kenya, South Sudan, Cote d'Ivoire, Ivory Coast, and Uganda. And the goal ultimately of this project is to increase the enjoyment of human rights by women and girls and advancing gender equality. And the target of this project is a bit unique. Typically, many of our projects would target, for example, women or adolescent girls or children in a more broad sense, but this project specifically targets organizations. So the target group for this project is women's rights organizations and local women's movements. And it's a 5-year project. It's ongoing till 2024. And just to give some background about why it's so important to focus on women's rights organizations. So with the specific women's rights organizations, for example, that we work with in Kenya and South Sudan, they're fighting against various types of human rights abuses that impact women and girls in Eastern Africa more broadly. So these include various forms of sexual and gender-based violence, femicide, early and forced child marriage. And it's a context where oftentimes women and girls who speak out against abuse can face consequences. They could be jailed for defamation. They could be forced to marry their perpetrators of violence. Women's rights organizations have a really important role in this context to speak out on behalf of women and girls who are survivors and don't have a voice. And the organizations play a triple role. So their first role is raising awareness about these issues in the community and placing them higher on the agenda. So specifically issues that violate women's rights. The second is advocating for policy change. So doing a lot of advocacy work. And the third is providing services or doing gap filling for services that address the needs of women and girls that are not currently being covered by the government. So because women's rights organizations often lack support, they're often not working in an enabling environment that supports them within the systems in which they work. A lot of times they're restricted by unpredictable funding. There might be a shrinking space for civil society organizations to have a platform. And a lot of times advocacy spaces can be blind to different gender issues. And so there's really an identified need for capacity building, equitable competition for funding that includes women's organizations and locally led organizations, strong strategic structures and better forums for collaboration, not just of women's organizations with their advocacy targets, but also cross collaboration between different women's organizations. And so essentially the project aims to empower women's rights organizations and foster collaboration between them. It provides them with a different type of funding structure than typical projects. So it allows them to submit proposals and compete for funding while making sure that they all align their priorities together. So in this way, the funding really can address the specific needs without being so restricted. And yeah, I mean, the ultimate goals of the project are to improve governance, management, and programming and sustainability of women's rights organizations in the 4 countries, to enhance their ability to deliver quality services and to increase the effectiveness of local women's movements. So I know I didn't get a chance to talk much about kind of like the private sector and the government, but I did feel that the focus on women's rights organizations is a really high value for CARE, and it's also a high value for the Canadian government and the FIAP. And it's also an area that might not get as much airtime or that can often be underlooked. So that's why I've chosen to focus on that type of collaboration more specifically.
Yeah, thank you so much. We appreciate everything you've spoken about, and specifically regarding this question pertaining to the challenges and the opportunities when working with civil society organizations. At this time, I'd like to open the floor up to our YPH. And if you have any questions, feel free to unmute your microphone or to share in the chat. We'd love to hear all of your questions. And if not, I have a few questions of my own. Oh, Rachel.
Don't be shy, you can ask me anything.
Thank you so much, Maya, for everything you've just shared with us. The part that really sort of resonated with me was the 2 case studies that you shared of the work of, not just yourself, but Care Canada, particularly the program in Haiti. Very, very interesting to me. It's exactly the kind of impact that I hope to create in my career also. So this isn't so much FIAP related, but just related to like you and your organization. You're the gender equality and inclusion specialist, right? So both of those projects are sort of very, very lovely examples of sort of the impact that we can create. I was wondering what of those 2, like what elements of the programs you are proudest of?
Sure. Yeah, so I just to give a bit of like background about the capacity in which I work. So our organization has a global programs unit that's responsible for all of the programs that are implemented internationally. And then within that unit, we have what's called the Program Quality and Impact Unit. And then within that unit, we have a gender equality and inclusion team. So we have 2 gender equality advisors and a gender-based violence advisor and myself, and we all kind of work on different projects. So when it comes to the 2 projects, you're talking about Feed 2 and FemChem, right? The nutrition project and the health project. Yeah. So I would say that for the project in Haiti, the context has really been quite challenging because it's quite volatile, and it can be quite unpredictable. And the structure of this project is more so a development project, or what we might consider a nexus project. So it has kind of longer term outcomes, and it's not structured in the way that a humanitarian program would be structured, but we're operating in a context that can be quite humanitarian at times. And so CARE has an approach called social analysis and action. And essentially this approach is a community dialogue approach that's aimed at transforming social norms. So it's a whole process that involves transforming our own staff, and then training community members, and encouraging them to facilitate dialogues where they break down different social norms that could be hindering the outcomes of the project. So one example could be decision making within the household, or allocation of resources, or task division within the household. How much time is being spent on paid tasks versus unpaid tasks, and sort of breaks down these different norms. And there was a while where we weren't sure if it would be possible to implement the approach in this context, especially due to how difficult it was for people to move around, for people to even meet in person. But we eventually kind of worked with the team to find a way for this approach to be launched. And it was a new approach. It's not a new approach for CARE, but it was a new approach for the country. And we've already seen like some very strong motivation to work on this approach and some really great results. And it's just, it does link back to the FIAP in the sense that a lot of these challenges that are underpinned by gender equality can't be addressed unless we work on social norms, because that's really at the root of a lot of these issues. And so to not be sure whether this approach would work and then have it roll out, I think was a big success in that project more specifically.
Yeah, that's absolutely huge. I know very well about sort of the general distrust of services in Haiti can be a huge challenge. So yeah, very cool. Thank you for all that you do.
Helena, the floor is yours.
Thank you so much. Hi, Maya. Thank you for your insight and wisdom. Yeah, I'm just curious in relation to YPH. Like, what are the ways in which the youth can contribute toward the implementation of FIAP action area in relation to your work?
Yeah, I wish I was more of an expert on this project, but we have another project that we implement at CARE called She Soars, and it's another sexual reproductive health project, but it's focused more specifically on out-of-school adolescent girls in Kenya, Uganda, and Zambia. And as part of that project, they had a partnership with kind of like a youth advocacy coalition where they were doing youth advocacy for the project, but at the Canadian level. So I don't want to like be quoted on this because I would have to like look it up and maybe share after. But that is one area where one of our projects actually does have like a direct link to the work that young advocates are doing within Canada and ultimately contributing to this sexual and reproductive health project that we have being implemented in those 3 countries.
Right, that's helpful. Thank you.
Maya, I have a question. Do you think Canada's on track to fulfill its FIAP promise?
It's a pretty big question. On track in terms of which goal specifically? In terms of enhancing gender equality, in terms of ensuring that international assistance is framed within a feminist approach?
I guess even you spoke about health and nutrition. I guess goals pertaining to that sector or education, or even the 2 you mentioned.
Yeah, so I do think that there has been a lot of progress made, especially when we look at the area of sexual and reproductive health. Sexual and reproductive health is an area that was historically rather underfunded, and it's been quite a big undertaking in the FIAP. And I do think that is definitely very clearly shown through the work that I do at CARE, because we do have so many projects, especially newer projects that are very strongly focused on sexual and reproductive health. And we've seen very clearly the impact that the long-term impact that sexual and reproductive health scaling that up can have on so many other outcomes related to human dignity. I mean, Bernice like highlighted some of them in her presentation as well. We're talking about things like reducing maternal mortality, enhancing access to contraceptives, which is closely correlated with better education outcomes and also closely correlated with nutrition outcomes. And yeah, I mean, with the FIAP funding approaches like Women's Voice in Leadership, hopefully that's paving the way to different ways of structuring humanitarian or development work when it comes to financing structures, and having a structure where it's a lot more localized and women's organizations have a lot more power in decision making in terms of what they're able to do with the funding, so that it actually meets the needs of people that are on the ground and working in those contexts, rather than it being an entirely top-down approach. So yes, I would say that I'm optimistic.
Thank you. It's a very pressing question. I know it's very large, but thank you for answering that. I want to now shift to your why. Essentially, we all have, in this group in particular, with the YPH, we have a tremendous group of leaders who are all ambitious and want to make a positive impact in the social impact sector, specifically for humanitarian-based causes and for enhancing and promoting sustainable development goals. I know you have extensive experience working for global humanitarian agencies. And if you feel comfortable sharing, what is your why?
Yeah. So, I mean, I essentially got into this work from the beginning from a very health-focused perspective. So my educational background is very much in nutrition and health. And I think over time, the more that I worked on nutrition and health, and the more that I was based all around the world and kind of seeing firsthand the different nutrition and health challenges that exist on a global scale, it became more and more clear to me how much gender equality is tied into that. And it's not effective to work on nutrition and health if you're not considering gender inequality. Women and girls make up half of the population. And so without addressing those kind of underlying causes of poor nutrition and health outcomes, and without recognizing how much of a role women and girls play when it comes to ensuring nutrition within the entire household, in terms of being a caregiver when it comes to family members being sick, or in terms of their role within the healthcare workforce, it's just became more and more apparent to me how critical it is to focus on making sure that women and girls aren't just seen as kind of the caretaker role, but they're really more empowered to have a decision-making role, and that their voices at decision-making level are just as represented as they are at a caretaking level. So I think that that's why I chose to shift my focus into gender equality and kind of bring together those two schools of thought or knowledge together. So health, nutrition, and gender equality, because they are so intertwined, and I don't think you can work on one without working on the other.
Thank you very much for that. To our audience, do you have any questions? Feel free, please share. But if not, Maya, I know you discussed your sort of motivations and why joining the humanitarian sector. Do you have any stories that come to mind about your favorite success early on in your career, or maybe a mentor that motivated you to pursue future ambitions?
Sure. Yeah, I'm trying to think. I think, I guess early on, I didn't always know that I wanted to work within the international development sector. I was studying nutrition, and it became apparent to me that I was interested in looking beyond just the nutrition and health landscape within the Canadian context. And I started to get really intrigued and passionate about the fact that there was all these nutrition and health issues happening globally around the world. And I felt like I just wanted to kind of broaden my focus and move outside of the confines of my degree, or what my degree was designed for. And so I guess my advice would be, I guess it's easier to tailor your path how you want it than you think it is. Sometimes all it takes is just asking or sharing that. So I shared that with an advisor that I was like a research assistant on a nutrition project, and I basically shared that I wasn't happy in the program, and that I made a mistake. Should I have studied international development? And so she basically just said, you know what, maybe you can help me on this thesis research project instead of doing all of your clinical courses. So I completely just changed my path and didn't continue pursuing clinical nutrition, and I just went straight into more of a international development focus. And that one conversation sort of changed the path of my career. So I would say, yeah, my advice is to just, if you want something, follow that path and let people know and talk about it and reach out to people, because you'd be surprised how flexible things can really be if you just go for it. And I guess that's what I learned early on, before I even started my career, more in my kind of education journey, I would say. But that definitely forged the path that I'm on now, or was a turning point.
Yeah, lovely. That was going to lead to my last question, which is, what is your words of wisdom if you had to give to our youth policy hub? Well, you essentially answered that. I wonder, do you have like a specific motto in mind that sort of drives you? Like, for instance, I always think of plant seeds for trees that you'll never. Oh, what's the phrase? It's plant seeds for trees you'll never sit in the shade in, and I love that one because that reminds me of a lot of the work that especially people in the humanitarian sector do. You won't see those results, especially in the short term. These will be results you'll see even past when we're gone, and that's totally fine because it's for a greater mission. So I wonder, do you have sort of a motto that sort of drives you and your ambitions?
I don't know if it's a motto, but I guess I would say, like, every conversation counts. Don't underestimate the power of like one small connection. And you know, sometimes when we're trying to advance in our careers, we think that there might be certain types of people that we need to reach out to or talk to, but kind of like everyone along your journey can provide you with some type of wisdom, and it's important to lean on your networks and create new connections, because you could save yourself a lot of time if you speak to someone that's already been through the same kind of similar path that you want to go on. Even like the same professor that helped me forge my path when I was studying kind of said that, like, you know, if you are interested in something and you want to get somewhere, just go to their LinkedIn profile and look at someone that has the job that you want, and like look at what path they might have taken and reach out to them, speak to them, ask them, you know, what did you have to do to be able to get to XYZ? And no one's path is going to be like perfect. It's that's not how life works. So of course, like, my path wasn't perfect either by any means. But yeah, I think just being open and not underestimating the power of a simple conversation or coffee chat or advice could have in terms of the decisions that you make that kind of put you on whatever path that you may take in your career or in life in general.
Maya, it's been an honor and a privilege to have this discussion with you, and I thank you very, very much. I would now like to kindly pass the floor back to Rachel for her closing remarks.
Sure. Yeah, thank you so much, Maya. It's been such a pleasure to learn from you and to hear all of your words of expertise for us all. So thank you. I will definitely continue to reflect on today's discussion, as I'm sure all of us here today will. So thank you for your time, for your energy tonight. Also, a huge thank you to my fellow YPH members, Devon, wonderful moderation, Bernice, who created that activity all on her own as a complete surprise, and Brunnerby for that wonderful land acknowledgement also. And to the OCIC team, Pragya, Helena, Sagarika, you've made the success a success, as you do with all of our FIAP series. So thank you so much, everybody, for your help. With this, we will conclude today's session, and I invite you to stay tuned to the OCIC social media for all of their upcoming events. The dates and times of our forthcoming Policy Matters series are going to be posted in the chat. Oh, I'd also like to point out, Maya has just said, feel free to reach out to her on LinkedIn as well. Thank you so much for that. I'm sure many of us will. The dates of our January and April FIAP Action Area series are now in the chat. Thank you, everybody, for joining us. Have a wonderful evening, and we look forward to seeing you again soon.